Hey guys, I'm Brandi Baker. I'm a student physical therapist assistant at Jeff State, and today I'll be sharing my treatment plan with you. My patient is a 64-year-old female with a diagnosis of osteoarthritis of left hip. This is a progressive destruction of articular cartilage, and formation of osteophytes can also occur in this. Patient was referred by MD with the diagnosis of hip osteoarthritis. The patient's past medical history shows osteoarthritis in bilateral knees. Some subjective findings for this patient is symptoms are worse with sit to stand, therefore making transfers harder to perform. Symptoms are worse in the AM with stiffness that generally lasts for an hour. Some objective findings is there is limited and stiff anterior glides on the left hip, lacking extension and active range of motion and passive range of motion with capsular infill on left. Joint mobilization. Anterior glides of left femur with grade 3 mobilization will help to increase hip extension by stretching the joint capsule and increasing its sensibility in the anterior portion of the capsule. This allows for more range of motion. Some subjective and objective findings for this is left active extension lacking 10 degrees, passive extension lacking 5 degrees with capsular infill. I will now demonstrate this. First we're going to start with a joint mobilization of the femur on the acetabulum. We're going to do a grade 3. We're going to start by putting the hip into a slot. It's 30 degrees of flexion and 30 degrees of abduction and slight external rotation. Let me get you to slide this way just a little bit. Alright, and we're going to distract by pulling on the femur. And you're going to push down to get through the soft tissue. We're going to go to one end of the joint capsule to the other, and that's a grade 3. Does that feel okay? Yeah. This is going to help the patient with extension of the hip because she's lacking extension by pushing the capsule. It'll be stretching the capsule and the extensibility of the capsule. I will also be educating the patient on how to perform a sit-to-stand transfer correctly. The patient is to stagger feet with right lower extremity behind left and pushing body up with right lower extremity in correct posture. This is important for the patient because it will reduce compressive forces on left lower extremity to help decrease pain with transfers and making it easier to perform. Now we're going to educate the patient on how to perform a sit-to-stand correctly. She's experiencing some increased symptoms when performing, and it's making it difficult for her to perform the transfer. We're going to get her to stagger her feet, put all of her weight on her unaffected leg when standing. This will help to take off some of the compressive forces that's causing her pain. Alright, what I want you to do is I want to take this right leg and put it behind your left. Put your left kind of forward like this. And I want you to scoot up in your chair just a little bit. You're going to sit up with a neutral back. You're going to put all of your weight through that right leg when you stand just like this. You got that? Mm-hmm. You have any questions? No. Alright, can you do that for me?
Put my right leg back.
Mm-hmm.
My left leg forward.
Mm-hmm. Alright, looks good. We also did a home exercise with this patient. We did a psoas stretch. This will increase hip extension because this muscle is responsible for hip flexion, and if tight, it will inhibit extension. Some subjective and objective findings was that the patient presents with a positive Thomas test, left hip extension, active range of motion lacking 10 degrees, and passive range of motion lacking 5 degrees on left. The exercise parameter is that the patient is to hold a stretch for 20 seconds and do this 3 times. Perform stretch twice a day, and if possible when waking up in the morning and before bed at night to help with AM stiffness. We also educated the patient on precautions and safety considerations when performing the stretch. Should not feel any pain during stretch. If pain is felt, slowly come out of stretch and consult physical therapist. Also remember to breathe normally during stretch. Try to inhale when going into stretch and exhale when releasing stretch. I will now demonstrate this. Now we're going to be teaching the patient a home exercise. We're going to be doing a psoas stretch. The psoas muscle is responsible for hip flexion, and if tight, it will inhibit extension. This patient has a positive Thomas test, which proves that there is tightness in the psoas muscle. She also has a lack of extension, so stretching this muscle can help with her extension range of motion. Alright, I'm going to get you to come over to this chair and put your left knee on the chair and step forward with this right leg. I'm going to get you to move your pelvis forward and keep your torso back. Lean into this leg just a little bit with your pelvis. You feel that stretch on the front of your leg?
Yeah.
Okay. You're going to hold that about 20 seconds, and we would do this 3 times. And we're going to do it twice a day. Try to do it in the morning and at night, and this will help with some of your AM stiffness. You also want to remember to breathe during the exercise. Breathe normally, and whenever you go into the stretch, try to inhale, and whenever you go out, exhale. Does that sound okay? Mm-hmm. If you feel any pain with it, stop immediately and just consult to me, and we'll try to fix the problem. Any questions? The prognosis for a patient with osteoarthritis can vary patient to patient. Although it is a progressive disease, it does not necessarily have a bad prognosis, because with proper physical activity and symptom management, OA can stabilize instead of progressing. The patient may require modifications to resume to previous level of function, such as a cane to help reduce compressive forces on hip to allow them to ambulate longer times. This is a part of symptom management.